starting trigger point, yeah? Trigger point technique is, so what we've learned so far is about what is a trigger point. Remember some of it? What is it? Is it objective or subjective finding? Is it something that you can feel and say, aha, it's there? Or at times it's something that the client say, it's a tender point? What do we say?
Subjective.
Subjective, yeah. Okay. It can be also objective, but a lot of it is the tenderness. And what is the difference between a knot and a trigger point? One is there and the other one is...
Yeah, trigger point, when you touch it, it sends symptoms in other places.
To other places. Good. So an example we gave is the heart, yes? So if the heart's muscles is not receiving enough oxygen, it can give pain symptoms that would be coming from the arm, jaw, chest, shoulder, left side. Why there are those extra symptoms in a trigger point?
Because brain is confused, brain gets all the information from
brain can have information coming from different organs into the same place. So once they have pain, they're saying, oh, I'm not sure whether it's coming from here and from there, or from there. Yeah? Good. Great. So the treatment for trigger point called at times neuromuscular. But when you're looking at the treatment, it's very similar in Swedish terminology to compression, friction, combined with stretch, with positional release. And all that together, it's actually a neuromuscular technique. Yeah? It's just another name for a complex it's like taking few colors and painting a picture. Now each technique would be a color, but the picture together would be something different. Okay, enough talking, let's start. I would like to show you the first one on the infraspinatus muscle. So to locate it, one important thing about locating the infraspinatus or anything is that it's quite hard when you palpate when the things are not moving. So try to move and see through movement you can locate a lot easier any structure in the body. So for example the scapula. Okay, I get a sense now, here it is, the lateral border, inferior angle, medial border. Yeah. Okay, so infraspinatus I come through the side, okay? And I'm looking for the lateral border where teres minor and major are, and then hop into that, and that's the infraspinatus. It actually feels like a bone more than a muscle, but it's it. Okay, so this is the location. First of all, we need to warm that area, yeah? Taking a bit of nice chemodol and start the massage. Now, the person may come completely for a relaxation treatment. For me, there is a big difference between someone who's coming for a relaxation massage, in which I don't want to evoke a lot of pain, to someone that comes with a problem. If somebody comes from a relaxation massage, I'm not going to interrupt the relaxation. They need it, I'm going to deliver it. But if someone come and say, yeah, I have that issue and I want you to solve it, for me that's the window to actually say, right, I can intervene more, I can create more of the good pain, but I don't, it all depends on the reason really, on the occasion, yes? It's like family occasions. You're gathering for celebration, let's celebrate, let's relax. You're gathering for getting business in between family members, let's get into business and talk how we can improve it. But you try not to mix it too much. Now, what if someone comes to massage and say, oh, I want to relax, but also I have this issue. I have a bit of pins and needles there. So I can suggest to start with to say, you know, during the massage I'm going to give it a relaxation massage, but if it would be all right if I find something that may help you to treat you with it. Yes, okay, or no. Right, so we're doing pet massage, and you start palpating. Right. Now you may feel tension in here, so you could say, how is it, Patrick? Do you feel any tenderness or?
I feel a little bit in the middle there, somewhere.
Yeah,
in the middle.
okay. So here it is. Now you sort of switch into more treating the trigger point. How is that?
A bit painful.
Tender?
Mhm.
Is it a local pain?
No.
Where does it go to?
To the arm, to the shoulder.
Okay. So that would be it. Okay. So here, what would you say now? You say, okay, I think I find an active trigger point. I'm going to ease off and treat it. So you can do it with your base of the thumb, of the wrist. How are you doing?
It's okay.
It's okay? Or you can again locate it. Am I on it?
Yeah.
Okay. Ease off. I want you to breathe. And breathe out. How's it? How's the pain?
It's okay.
Yeah? Can you manage?
Yeah.
Rather than do it short and thick, I would rather do it a little bit, you know, less pain, but over a longer time. And then I try a little bit easing off the pressure and doing circles. Yeah. And then maybe moving to another place. Okay. Circulate it. Good. At that point, for example, using that trick we learned yesterday, can you lift your shoulder? Thank you. Good. Would be a huge benefit because now the infraspinatus muscle is actually relaxed and you're working with odds, not against them. I find the palpation most important. It's where do you do that? How is that?
It's okay.
Did you see the twitch here?
Yeah.
Did you see that? Yeah. That's another symptoms of it. It's the twitching. Is that the nerve system saying, whoa, 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 what are you doing? You can have even sweating or changing the color of the arm because of blood circulation. So you have to be very attentive to all these small changes that happened. You have to be 100% there, looking at it. Am I on it?
No.
I think it's a little bit here.
Mhm.
Yeah. Okay. Have you seen what happened to his? Yeah. To his shoulder.
We can't see on the video, but
Keep breathing. Sorry.
we can't see on the video.
It's all right. It's you know, you would see it with a real client. Good. Good. Always after, get nice effleurage around. It's almost like bringing this body part back into the community of the body. Okay. That could be one way of doing it. Another way could be leaving it into here and actually moving putting your finger on the same place and just mobilizing it, moving that area. Or doing the same mobilization we've done yesterday. but it's quite hard because you need to know where you are and move it.
Multitask.
So multitasking, exactly. Yeah, and I find a lot of the advanced massage technique is about multitasking. It's about knowing one good thing, one thing well, and doing it together with something else. And by then, you talk to the nervous system. You try to confuse it. What I'm doing here is saying, okay, relax, let go, you know, still, and I can feel the muscle move. So he cannot contract it. He has to relax it while I'm still working on that and improve the blood circulation. How does it feel?
Good.
A lot of it is a distraction technique to not get the client so much concentrating on that. Let go, relax, you know, let's take a walk. And then, you know how it is, sometimes you're sitting and you want to talk about something quite complicated. If you're walking, then it's a bit easier. You can walk and talk, and it brings an easier atmosphere into it. Yeah, good. Don't forget now, try to bring it to other muscles. So around that, rhomboids, you can do some of the rhomboids. Okay. Shall we try just this one? Location, and try in two ways. Try just with the thumbs, and then try with the mobilization. Okay? And then I'll show you other ways to do the same muscle. So now let's look at the trigger point in the forearm. So when it comes to the forearm, there are sort of 2 to 3 major group muscles. The flexors that flex the arm, and the common origin come from the medial epicondyle, medial elbow. Yeah, can you palpate it and feel that area? Yeah. It's quite tense. Can you actually tense these muscles and feel? It goes in here. There, on the lateral side, it doesn't do. Medial side gets very tense. So all these tendons goes to muscle to the medial side. Now the middle group is coracobrachialis, yeah, which is that bit. And then the extensors goes to the lateral epicondyle. Yeah, and they do that. Try to extend your wrist and you feel those. And it goes to put it in an anatomical position and you feel that in here, but there is actually the ulnar is on the medial. So it's on the lateral side. You feel all this muscle goes to here. Okay. Now when it comes to trigger point therapy or neuromuscular technique therapy, the one that for learning purposes are very good because it shows the symptoms is on the coracobrachialis or the extensors. Some people come and would say, you know, I have a bit of numbness here, or pins and needles, or pain going down the line. So you, and this is an indication that maybe a trigger point caused that. It could be also coming from the neck, trapped nerve, and few other entrapment here. Radial nerve can be entrapped around the elbow, but let's say if there are no symptoms rather than that, then you can treat it. Right, so how do you can do that? You are palpating the medial compartment, go a little bit more to the dorsal area, and you look for trigger point. And what would be the indication of a trigger point?
My facial expression.
Facial expression, and actually tenderness or some sort of a pins and needles or numbness going to.
Yeah.
Yeah. Does it radiate anywhere?
No.
No, it's a local. Okay.
I can feel a little bit numbness going down,
Okay.
but not pins and needles.
Okay.
Sorry.
That means, right, she might not have a trigger point there. It might be tender point, but
It
not
is
trigger
tender.
point. Okay. So then, treatment-wise, it would be quite similar to what we've done before. You can put the arm into here and then use compression. Okay, sorry, it's a bit too much. Put in a few minutes, a few seconds. How was that?
It hurts, but I can take it.
And then you can relax. You can mobilize it a little bit. Supination, pronation. Remember what we done with the infraspinatus of that mobilization, yeah? So you do that with either a flexion extension, and you can still working on that, and in a way a bit distracting the nervous system. And also checking that actually the hand is quite relaxed, yeah? And I'm still on that tender point, or sometimes trigger point. Again, I don't call it now trigger point because it doesn't have this shooting pain, pins and needles, numbness, any other area. Okay, so exactly where it is. Okay, you have the elbow. This area is below the elbow, on the extensor side, and there are always tight muscles here. Feels like a tight band. Sometimes just a finger would be enough. Okay, and let go. Relax. Then more effleurage. Yeah. I've said the treatment of it is quite similar, but the anatomical precision is the core. It's not a new technique, it's same technique but into more specific area. Rather than do effleurage, pétrissage, you are a lot more specific. And in a way that's where you are looking for the secret of the body. And the body teaches you where to do it. What is exactly the point? Well, not a muscle, but actually a point. And sometimes if you're coming from here or here, makes a whole difference. So it's a lot to learn, but process would continue from each client of yours. Yeah. Should we? Okay, so sternocleidomastoid, right? To look and locate it, you can turn your client's neck and then ask them to lightly lift your head. Do you see that? Comes very quickly. Good, you can relax now. Now, if they can't relax, you can put a bit of pressure onto their head. Now, first of all, what's the safety issue we have here is that it crosses the front and it has all the, carotid artery and quite dangerous structure. There are some nerves that going down, vagus nerve and phrenic nerve, other nerves that you don't touch the front of the throat. That's why we never do pressure points. We do more of finger kneading. Yeah? So you and you do very light movement. Now, do you remember where we were with the pain location? It could be here, it could be here. Remember? Yeah. Did you feel any of it?
There.
Yeah. Well, interesting because it was not high on the list, isn't it? It was more in here and more in there.
Oh, yes,
But at times, that's the indication,
So it's head there.
Yeah, okay. So it has more of a third pain somewhere else. And you can see that when you go up and down, it will change. So again, how to do that? If you cannot find it, ask them to lift the head a little bit and then relax. And then, I remember my massage therapist, it was 19... I don't know, it was a long time ago. How long ago was it? Maybe 15 years ago? Yeah, 1998, so 15 years ago. she called it the money muscle because it's like, you know, doing that movement, yeah? Do you see the twitching? I need to ease off a little bit. Good. And then after that, maybe a bit of stretch. Not great, you can do quite superficial effleurage in here, but, you know, not much. You can maybe put it back into here and maybe just move. Remember the movement we did yesterday? You know, just oscillate it and relax it. How does this movement feel?
Okay.
Yeah,
Just
not
make
great?
me a bit dizzy.
Yeah, that's the risk. So at times people would love it, at times people say, oh, you know. Good, other side. It's quite a tender muscle, usually. So treat it with care, slow. I would suggest at that time to always treat the suboccipital area. Because it's also one of the areas that you can have headache coming from that. So it's very good, yeah? Those two, yeah? Quite simple. Do not press down, ever. Yeah, do not press down. Only try to, it's hard to lift it, but squeezing and looking for tender, looking for trigger point.
How does massaging that area help with?
Well, if you have an increased lordosis, what happened to the sternocleidomastoid muscle? That it was shortened. So what you're trying to do is, and when it's shortened, it will get all these trigger point, tender point, knots. So what you, instead of just leaving it and stretching, you can work on the muscle itself to, it's almost like having a compression or petrissage to that muscle. Yeah, but in much more specific point. So you don't do a whole muscle, but you're looking for the tender point and then pressing and releasing, pressing, releasing. It's like compression, pretty much.